In the UK today, there are said to be 800,000 people with dementia. As our populations get older, more people living to later life, then the numbers of people with dementia is increasing all the time. Studies have shown that the cost of dementia to the UK economy is more than £20 billion per year. It's huge. Over the past few decades, the amount of research in Alzheimer's disease and the other forms of dementia has increased considerably. We need more funding for research. We need to accelerate efforts all over the world and in collaboration. The UKCRIS system was first established at the South London and Maudsley in South London. And then it's been extended to further sites in London, Oxford and Cambridge. And what UKCRIS does is begin to roll this system out across the UK. CRIS stands for Case Records Interactive Search, and what CRIS does is it enables the use of electronic medical records for research purposes.
UKCRIS is about bringing the clinician and researcher community together to work collaboratively.
At the moment, there is no way of accessing electronic medical records other than on a single patient basis and for clinical use. What CRIS does is allows you as a researcher under certain circumscribed conditions and with ethical approval to access not just one patient, not just 10 patients, but all of the patients to find all of the information that's relevant to your research. There's lots of things you can do with this kind of information. For example, you could ask the question, how fast do people decline with dementia, and are there differences between people who decline quickly and people who decline slowly? And then if we can find out the differences that relate to the speed of decline, maybe we could find out how to turn somebody from a fast decline to a slow decline. I think the numbers of programs of research that we could do is almost unlimited.
We've struggled for a long time trying to find ways to access all of this information that's just locked away, but essentially is used by a clinician on a case-by-case basis. So the UKCRIS offers us the opportunity to actually really dig deeper into those records and look at all of the data we hold in a way that we've never looked at it before.
We will be able to screen much larger numbers of people. So it's probably worth us thinking about, if we were patients, what would we want to hear from the organisation? Say, well, what are you going to do with my data?
The biggest challenge has been the information governance around making sure that our patients are adequately informed and that the data is going to be safe. It's really reassuring ourselves that we're in control.
It's really important to understand that when a researcher accesses UKCRIS, they do so under very controlled circumstances. The information is completely pseudonymized. What that means is there are no names in there. Nobody can find out the person that the information relates to. All of the research is anonymous.
The next stage is about making sure that we can deliver the technical requirements so that when we extract our data and send it over the internet to the UKCRIS servers, that it knows what to do with it.
When I started looking at how we might do this, it involved paper notes, often fairly large sets of paper notes, often incomplete. And the great thing about CRIS is it automates that, and it automates that at scale. So instead of just going out to one team base in Crediton for an afternoon and then maybe to Honiton the next day, my operative can sit with the CRIS system and see all the centres in the trust together.
Our academics are very excited about the opportunity to start using essentially years and years and years worth of data in a way that they've not been able to before. That means we can start to answer questions, really hard questions about whether what we do works, whether it's of benefit to patients.
I think the importance of a big data set, as we might call this, is that it not only gives you the snapshot of what's going on for people across a very large geography, it also over time builds the story through the weeks and months and years. And that's huge, because for the first time we might be able to say something in quite some detail about the natural history of these disorders.
Partly we're looking at, will other trusts within the East Midlands pick it up? If they do, then we would be able to look at population across the whole, but also looking at trusts in other areas so that we can compare. If we're looking at a city population, are there differences to a rural? If we're looking at, so we run a high secure hospital, being able to compare our data with the other high secures in other areas is really important.
UKCRIS is establishing a federated system. That means you'd be able to access multiple different trusts at the same time. And we're hoping to be able to connect some of the UKCRIS data with other data sets.
So that ability to federate and have that larger patient sample for different elements is going to be really important.
Looking forward to the future, we might think about how CRIS could actually become a tool for better clinical practice as well. Could we incorporate elements within the electronic medical record using CRIS as an infrastructure that enable doctors, nurses, others to be better at what they do?
Our assumption is the more effective we can be, the earlier we intervene for somebody, so their length of illness is less, hopefully the overall cost is less. But it's doing that reduction in finance the way we want it to be by improving the quality rather than just taking out money and service in order to save money. If we can actually improve quality so that that service isn't needed, that's the type of saving that we want to be achieving.
By the time UKCRIS is fully implemented in the current phase, we'll have it established in about 15 NHS trusts. Now, we don't know until we've completed the process, but we think that will be about 2.5 million patients.
Over 2.5 million electronic patient records that will form part of the CRIS database. That is scale at anyone's level.
I think UKCRIS is an enormously exciting programme, and of course it works not just for dementia but for any other disease area that's within the mental health record. So it's as applicable to bipolar disorder, depression, anorexia and all of these other conditions as well.
The research cycle takes years. The joy of UKCRIS means that we can shorten that journey right down. That will mean that actually research becomes a really powerful and immediate tool And that's something that we've not really been able to benefit from in mental health care.
I think it's transformational for our organisation.
I think it's hugely valuable and extremely unique in terms of that ability to get at that through-text data, work across the whole system, and particularly now if we can have multiple trusts involved, then we start to be able to use data and information to revolutionise the NHS.
Big data sets have a tremendous richness across all sectors to paint very vivid patient pictures of people's real journeys. So I think what will happen over the years ahead is that people sufficiently motivated and sufficiently consented will start to allow data sets from all walks of life to be drawn together around their lives, and that will give a fantastic personal biography that relates to their genome. So their genetic story and their real life story will be understood, and from that the research questions of the next generation will start to be asked and answered.